Hello, I am John Macfie, and I'm pleased to present my research report on personal pandemic responses. The, the COVID-19 coronavirus pandemic has been ongoing in the United States throughout the year 2020 and has challenged the lives of nearly all of Americans. At the time of this recording, over 260,000 Americans died while many others are coping with debilitating illnesses, including long-term health effects which are still to be determined. Over 22 million jobs have been lost, causing high rates of unemployment and financial hardships on workers and businesses alike. In most areas of the country, schools have closed, disenabling children to receive the same quality of education, attention, and social support than they would normally receive with on-site classroom settings. Many of these younger students are food insecure and rely on meals served at their academic places of learning to help them meet minimal nutritional requirements. COVID-19 has also led to increased depression, anxiety, and other related mental health challenges, driving higher suicide rates and other destructive behaviors. Individuals of color and those with disabilities or underlying health conditions, senior citizens, and other segments of the population have been disproportionately affected. The full effects of the virus are still unknown. President Trump, who had downplayed the virus and effects, stating that it would magically disappear, also became victim to the virus when he and the First Lady and members of their family and close advisors were diagnosed in October. An article by Business Insider reported that Amazon had seen a significant increase in sales of thermometers, antibacterial wipes, face masks, and pulse oximeters the day after President's diagnosis. This was after approximately 200,000 had already died from the virus. While the President had claimed that the virus was not of great concern, other officials such as Dr. Fauci, some states' governors cautioned Americans and advised on precautionary measures such as hand washing and mask wearing along with social distancing. This led to my curiosity as to whom individuals were listening to regarding their virus response. My preliminary research included a study by Weiyun Xiao from the Department of Geography at the University of Alabama and Feng Hao from the Department of Sociology at the University of South Florida. They reported in their study, confidence in political leaders can slant risk perceptions of COVID-19 in a highly polarized environment. Citizens that paid attention to the media tended to take the pandemic more seriously than those who did not listen to the media. The results reflected that conservatives perceived a lower risk to the virus and that confidence in leaders could reduce the perceived risk as well as the quality of the media. Other research revealed Virginia Heffernan of the LA Times examined different approaches to the virus by some states' governors in comparison to President Trump. She stated that both Governors Cuomo of New York and Newsom of California delivered leadership straight talk. They acted swiftly to order stay-at-home orders and gave the grim facts of the death of the virus to keep their residents informed and protected. She noted that this was in contrast to President Trump's claim that the virus would go away by Easter. She called his daily virus conferences self-serving. The citizens were given conflicting messages from various sources. I felt it important to identify those that hold influence, shape the behaviors of citizens of the United States regarding daily coronavirus practices. I examined whether or not those behaviors changed following President Trump's positive coronavirus test result. I developed three hypotheses. Hypothesis 1. If the population largely looked to President Trump for guidance with respect to the coronavirus, then behaviors would change significantly following his positive coronavirus test. Hypothesis If the population largely looked toward leaders or sources other than President Trump for guidance with respect to the coronavirus, then their behaviors would not significantly change following his positive coronavirus test. Hypothesis 3. Following President Trump's positive coronavirus test, a greater percentage of citizens would look to Dr. Fauci and other medical and science professionals that are subject matter experts on infectious diseases for guidance with respect to the coronavirus. An internet survey employing SurveyMonkey was conducted between November 13th and November 22nd. After the presidential election votes were gathered from the population, the majority of the states' electoral votes were finalized, with the exception of those from a small handful of them whose votes were being challenged by the president in his legal terms. The survey was designed to identify levels among government officials and other sources with respect to coronavirus behaviors. Changes in behaviors were examined following President Trump's positive coronavirus test. Demographic data collected from over 50 respondents include information on political ideology, age, gender, level of education, employment status, history of whether or not the respondents had a person or someone in their family that was stricken with the virus. The study included questions concerning feelings regarding levels of vulnerability at the outset of lockdowns ordered, levels of attention given toward the news media concerning presidential task force reports, guidance followed from a list of various government officials and other influences, along with behaviors that include mask wearing, the practice of social distancing, hand washing, purchase of antibacterial products, and more. Behavioral changes with respect to the activities discussed above were compared before and after President Trump's positive coronavirus test. Survey respondents tended to lean toward liberal political ideological beliefs, with 49% reporting that they're very liberal or somewhat liberal, while just over 25% of respondents described themselves as ideological conservative. The sample skewed toward a younger demographic, with nearly 63% of respondents under the age of 35 and approximately 41% less of the sample under 24 years of age or less. Gender was nearly evenly split, with 51% male respondents and 45% female respondents, with 4% of the respondents reporting as other. Individuals in the study were highly educated, with over 50% reporting completion of at least a bachelor's degree. An additional 39% reported that they have fulfilled some college coursework, with many of those in this category in process to complete their college requirements. The remaining 10% of respondents were completing their high school degrees, with the vast majority individuals expecting to attend college. Over 15% of those in the sample were directly diagnosed or had an immediate family member or household member diagnosed as coronavirus positive since the beginning of the pandemic. Throughout the early days of COVID-19, prior to the president's positive test result, where 35% of those in sample looked to Dr. Fauci, a medical expert and director of the National Institute of Allergy and Infectious Diseases, for guidance concerning the coronavirus pandemic. Less than 2% of respondents looked to President Trump for direction with respect to the virus. However, over 25% of individuals that completed the survey looked to their state governors for guidance. Approximately 85% of respondents often or always practiced social distancing during the early months of the pandemic prior to President Trump's positive test result. During the same time frame, over 92% of respondents either stayed at home or reduced their activities outside of their places of residence. 88% of respondents refrained from dining out, while 84% of those that did leave their homes wore masks outside, and 88% of respondents purchased antibacterial products, such as a mask as an additional safety measure. These practices were consistent with recommendations made by Dr. Fauci, countless media outlets, medical professionals, and by many state governors. After President Trump and many of his staff members reported positive coronavirus test results, over 84% of those sampled expressed essentially no change regarding their feelings of vulnerability to the virus. Behavioral changes in practice, such as mask wearing and practicing recommended social distancing, were either non existent or insignificant. In addition, following President Trump's positive coronavirus test results, over 49% reported that they looked to scientists and experts such as Dr. Fauci for guidance concerning coronavirus behaviors. The survey concluded with nearly 55% of respondents indicating that their beliefs that the election of a new president of the United States will lead to improvements with respect to fighting the coronavirus. Less than half of that amount, under 24% of those surveyed, believe that the election of a new president will not improve the coronavirus situation. These findings align with the results from the final survey question, which concludes that less than 28% of respondents believe that President Trump did an adequate or good job responding to the COVID-19 pandemic, while more than double that figure, nearly 61%, believe that the president did a poor job responding to the crisis. This hypothesis was not supported, as only a small minority of respondents, less than 2%, looked to President Trump for direction with respect to the coronavirus. Thus, it may be concluded that this hypothesis was not tested, though it may have been expected that the United States citizens may look to science and public health experts for guidance. It is notable that over 25% of those in the study looked to state governors for direction with respect to the coronavirus. 88% of the respondents in the study looked to Dr. Fauci, state governors, news reports, family members, other sources, or did not seek guidance with respect to the coronavirus. Less than 2% looking to President Trump. Given the limited percent of those that looked to sources other than the president, it was expected that his positive coronavirus test results would have limited influence on the behaviors of the citizens of the United States. Over 88% of respondents reported that they did not feel more vulnerable to the coronavirus following the president's diagnosis. In addition, two behaviors, mask wearing and practicing social distancing, were compared before and after the president's positive test results, with essentially no change in those behaviors reported. It is concluded that the data suggests that there is support for this hypothesis. Prior to Trump's positive coronavirus test results, just over 35% of those in the study reported that they looked to Dr. Fauci for direction with respect to the coronavirus. Following President Trump's positive coronavirus test results, over 49% of those in the sample reported that they looked to Dr. Fauci and other science and public health officials for guidance with respect to the coronavirus. It is concluded that the data suggests that there is support for this hypothesis. Follow-up interviews were conducted with select participants to further investigate why the study was inconsistent with the reports that Trump's diagnosis spurred purchases of safety equipment to protect against the virus, as reported by Business Insider. It is concluded that a reason may be that Trump was not considered a credible leader and lacked scientific knowledge about the virus. One respondent from North Carolina, a conservative state, stated that she felt that President Trump had lied to the American people, trying to downplay the severity of the virus, and lied saying it was under control. Further, that he did not listen to the scientific expert, nor did he lead by example, wearing a mask, and continued to hold large rallies against the advice of holding large gatherings. Another respondent questioned that President Trump's level of intelligence and understanding of basic science. It's known that this respondent had studied science and therefore looked to Dr. Fauci as a credible leader and expert in the field. There were a number of limitations with the study that should be addressed in future research. The sample size. The study was composed of 51 respondents, providing a representation of the United States population. Although respondents represent individuals from most of the states, the small number may not be fully representative, nor does it provide the opportunity to conduct statistical analysis to accurately test hypotheses. I'd like to thank the Omni program and Professor Chris Connor. Thank you for viewing my presentation.